Hey everyone, this is Dr. Andrew Kim, MD. And in the midst of our current national crisis, I already know that some of my patients, my friends, acquaintances have either lost their jobs or are on the brink of losing their jobs. And this is putting their healthcare benefits at risk. So this doesn't just mean access to healthcare providers, but access to their prescription medications. And right now, people are frustrated, people are scared, people are anxious, they're waiting on government aid, they're waiting on their stimulus checks. But let's be real, I know many people out there just simply don't qualify for that stimulus check. And many people are still waiting on their stimulus check, wondering where the heck it is, okay? So I know I said my next video was going to be about how to fall asleep faster, and I promise that's coming up soon. But given the current crisis, I felt that it was important to kind of make this impromptu video to talk about how to save money on your prescriptions during this economic crisis. And when times are tough, every dollar counts basically. So I want to try to give you some very, very simple tips on how you could make your prescription medications more affordable and more accessible. Now, this tip doesn't just apply to people who don't have health insurance or who have bad health insurance. This applies to even people who have good, decent insurance, like some kind of Blue Cross PPO. So what many people don't realize is that many of your retail pharmacies that you go to fill your prescriptions offer a select list of heavily discounted generic medications. So heavily discounted generic prescription medications. Now, some of you out there may know this already and you're rolling your eyes and you're saying, look, Dr. Kim, I already know about Walmart and Sam's Club and Costco, but look, many people don't. I actually get surprised by how many of my patients, how many of my friends, how many of my acquaintances don't know about these very accessible savings programs that are at stores and pharmacies they already go to on a weekly basis. So today we're going to focus and highlight the savings programs at Walmart pharmacies, Walgreens pharmacies, and Costco and Sam's Club as well to help you understand how you can save money on your prescriptions at these places. So first off, let's start with Walmart pharmacy. Now, Walmart is one of the simplest options in my opinion, and one of the better ones, to be honest with you. The reason that I like the Walmart savings program the most is number one, there actually is no fee. There's no membership fee, there's no annual fee that you have to pay. As long as you have a valid prescription to fill from a doctor or a nurse practitioner, etc., you can have access to the discounted generic drug prices as long as it's one of the medications on their list. Now, the second thing I like is the transparency and ease of finding out those prices. Walmart, which I love, basically just puts this list on their website, and you have to make sure you go back and check because they update it every once in a while, but they just simply list them here, and they list the prices, and they break it down into 1 month and 3 month supplies, and they list the prices right there for you. Now, a lot of them start off as low as $4, so $4 for a 1 month supply, and $10 for a 3 month supply, okay? And they have a few categories. It is a limited list, I will say, but look, they have things like diabetes meds, like metformin, and look, metformin is $4 for a 1 month supply, $10 for a 3 month supply. They have, let's see, cholesterol lowering medications like atorvastatin, a little bit pricier, $15 for a 1 month supply, $38 for a 3 month supply. And of course, because I'm a psychiatrist, I'm always interested to see what kind of mental health or psychiatric medications there are. And look, they do have a list. They have generic Prozac, they have amitriptyline, they have citalopram, and again, many of these are $4 for a 1 month supply, $10 for a 3 month supply. And again, I want to be clear, you don't have to have insurance. You don't have to have insurance. As long as you can figure out a way, and I know this is the hard part if you don't have insurance, but if you can figure out a way to get yourself to a community clinic, a county clinic, a clinic with a sliding scale fee, and get to a doctor, a nurse practitioner, to get a prescription, and as long as you have a valid prescription, those prices apply to you, okay? So you don't have to have insurance and you can go and fill it and get the prices that are listed here. So again, it is somewhat of a limited list, but I would check it and see if you can get a discounted rate and make your medications more affordable, okay? Now, again, this can actually be a helpful list even if you have insurance. And how could that be? Because you're going to say, Dr. Kim, well, look, my insurance covers most medications and, it's not really a big deal to me to pay a small copay. I would say if you have insurance, just double check and look at your copays, okay? Sometimes for generic meds, there's zero copay, okay? And you're not paying anything out of pocket. Copay is what you pay out of pocket when you go and fill a prescription at your pharmacy. So some of you may say, I have $0 copay. Well, for you, this really doesn't matter then because you're not paying anything when you pick up your prescription. You're just paying your insurance premiums, all right? But let's say, for example, it's very common that a lot of people have a $10 copay for a 1-month supply of their generic medications, okay? So think about that. Like one example that I could think of off the top of my head is thyroid medication. So some people take thyroid supplements or thyroid medications for having a low thyroid hormone. And one of the most popular ones is called levothyroxine. Now, some people, even with insurance, they'll pay $10 or $15 as a copay for a 1-month supply. If you look at the Walmart list, you can get a 3-month supply for $10, okay? So do you want to pay $30 or do you want to pay $10 for a 3-month supply? So this is just one example where you should just at least do a double check. And even if you have insurance, for some individuals, for certain meds, you may find that, I know it sounds weird, it's actually cheaper to go to Walmart and not use your insurance and just pay cash. And you actually get the discounted cash price, which may end up being cheaper than using your insurance. So next, let's talk about Walgreens. So obviously Walgreens is a well-known national chain of pharmacies. And Walgreens has a slightly different approach. Unlike Walmart, where as long as you have a prescription, you get access to the prices that we just reviewed, okay? Walgreens has a different approach. For Walgreens, in order to basically have access to, they call it the Walgreens Prescription Savings Club, okay? The Walgreens Prescription Savings Club. And in order to get access to that, you do have to pay an annual fee. So once a year, for individuals, it's $20 a year. For families, it's $35 a year. So for families, you don't have to pay the full individual price. So $20 for an individual, $35 for a family. So, why should I have to pay this upfront fee? I mean, what's the benefit of doing that versus going to some place like Walmart where I don't have to pay anything? Well, I will tell you there seems to be a benefit. And the benefit is the list that's available on the Walgreens list is a lot longer. So meaning there's a lot more choices of generic meds where it's in the hundreds, okay? So, this is about 4 pages long in very tiny font and small print. And there's definitely more options of discounted generic medications through the Walgreens Prescription Savings Club. So that is the benefit of paying that annual fee, okay? Now, the way that Walgreens prices it out, it's pretty straightforward. If you go to their website, what I like about their website is they have this list available. They always update it. So again, make sure you're always checking for the most updated list to see if your medication is on this list or not. They break it down into what they call tiers. So tier 1, tier 2, tier 3, okay? If it's a tier 1 medication, it's $5 for 1 month, $10 for 3 months. Tier 2, $10 for 1 month, $20 for a 3-month supply. Tier 3, $15 for 1 month, $30 for a 3-month supply. So it's very straightforward. They break it down into 3 tiers. They have the list of all the meds that apply, for this program, and they just basically list, is it a tier 1, 2, or 3 medication, okay? So again, they have a lot of different categories for different health conditions and a lot more options. Antiviral meds, arthritis, pain medications, asthma medications, blood pressure medications, like popular ones like hydrochlorothiazide. Let's see, $5 for 1 month, $10 for 3 months. Lisinopril, which is a widely prescribed blood pressure medication, $5 for 1 month, Again, $10 for 3 months. So again, you're going to find many popular generic medications that are on this list, okay? So one thing I do want to say, unfortunately, according to the Walgreens website, as of the time that I filmed this, these discounts and this prescription savings club, unfortunately, it's not available in Connecticut, Massachusetts, and Mississippi. So unfortunately, if you're in one of those 3 states, these prices don't apply. Next, let's talk about Costco, Sam's Club, and Sam's Clubs Plus, okay? So first, let's start with Costco. So Costco, as long as you have a Costco membership, you have access to their drug discount savings program as well. So again, if you have an active Costco membership, you have access to prescription drug savings through their pharmacy as well. Now, the one thing that's a little bit frustrating with Costco is that if you go to their website and you go to the pharmacy section of their website, you can see they actually list the medications that are going to have savings or discounts applied to them. The one thing that's a little bit frustrating is they don't actually list the prices or the amount of the savings. And it basically says, which I understand, it says contact your local Costco pharmacy, because depending on which region of the United States you live, which zip code, the prices are going to vary to some degree and the availability will vary. So you can actually see the list and see which meds may be applicable, but you're not going to be able to tell the exact set price, unlike what we reviewed with Walmart and Walgreens. So that is one thing that's a little bit annoying. But from my understanding, from patients of mine who have utilized this program, they basically tell me if your medication is on the list, the prices are relatively comparable to the Walgreens Prescription Savings Club and the Walmart prices as well. Moving on to Sam's Club. So Sam's Club is a little interesting because Sam's Club has the Prescription Savings Program for regular Sam's Club membership members, but they actually have another separate list for Sam's Club Plus members. So you need to realize that. There are actually 2 separate lists. So regular Sam's Club members and people who kind of paid for that higher tier membership of Sam's Club Plus, okay? For Sam's Club, they actually have this little search engine where you can basically go in, you can type the name of your generic medication, and you put in your zip code, and it's nice in the sense that they list the price of how much it'll cost for a 1-month supply at Sam's Club, and they'll also compare it to the price at Walgreens as well as CVS. Now, how accurate those prices are compared to the competitors, I'm not quite sure, so you may need to double check on that because, obviously it'd be in their best interest to kind of list themselves as the cheapest, but I would double check on that, but it's nice that they have at least a search engine function. Now, Sam's Club Plus, interestingly, they actually list, all their meds similar to Walmart, similar to Walgreens, and I have to say it's pretty extensive. So, they basically say they have over 200 prescriptions that can be priced as low as $4 for a month, and over 400 that are available at $10 a month, okay? And they do list a few other perks. It's a very limited perk, but there's a short list that they highlight here in this top right corner, if you take a look at the list, that actually offer a few free things. There's not many though, so I will tell you that there's not many, but there are a few Alzheimer's medications. There's escitalopram, which is generic Lexapro. There are some diabetes medications. There's even a free offering of a glucose or blood sugar monitor and some of those glucose strips that you use for the monitor. So, look, it's not a huge perk, but if you happen to be on one of those things, or you need a glucose monitor or glucose monitoring strips, and you already have a Sam's Club Plus membership, why not get it for free? It's literally free as long as you have a Sam's Club Plus membership. So take advantage of those little unique perks that are built into the program. Make sure that you still shop around for the best deal. And what do I mean by that, okay? Here's an example. when you hear about these different options, Walmart, it's accessible to everybody. Walgreens, you need to pay an annual fee. Obviously, for Costco or Sam's Club or Sam's Clubs Plus, you need to pay membership fees. So, right away, some people assume, the more expensive it is, the better it needs to be, right? The better it's got to be, right? But don't get fooled by that. So you need to be a savvy consumer. And here's one example, okay? I know I mentioned a thyroid medication called levothyroxine, which is better known as Synthroid. If you actually look at the Sam's Club Plus discount list, okay? So not even just Sam's Club, but Sam's Club Plus, where you have to not only have a Sam's Club membership, but the higher fee membership. Their 1 month supply of that on their list is $10. Okay, 1 month is $10 for levothyroxine. If you go to Walmart, they're owned by the same company. If you just go to plain old Walmart, and you don't have to pay any annual fee, you don't have to pay any membership, $10 will get you a 3-month supply of levothyroxine. So, same parent company, you're paying a membership and a higher tier membership, and you're paying more for the same prescription with less quantity than you get at Walmart. So to summarize what we've talked about, take a look at the list of your prescription medications, see which of your generic medications may be on these lists, okay? Right now, calculate how much you're paying either in copays, if you have insurance, or how much you're paying out of pocket for these meds, okay? Take a look at these lists, see how much they would cost at these places, crunch some numbers, and see what makes the most sense for you to reduce your costs and to save money on your prescriptions, all right? So I hope that you found this short and impromptu video helpful, and hopefully you can find a way to reduce the cost of your meds and make them more accessible and affordable, okay? And if you like this video, please hit that like button. Please hit subscribe. I'll try to do some more of these impromptu quick tips on just kind of helpful advice for people who are trying to navigate the healthcare system. Because look, as a healthcare provider, I know that it's hard enough to go find a prescriber or a clinician, let alone then deal with the stress of how am I going to afford my meds, okay? And right now, with the current healthcare crisis, with the current economic crisis that we're going to be facing for months, I know that many of you out there are either just recently out of a job, looking for a job, struggling to support yourselves and your loved ones. So I pray that you can kind of weather this economic storm the best you can. My prayers and my thoughts go out to you, during this journey of trying to find that new job, to hopefully get some financial aid, to hopefully qualify and get that stimulus check or those business loans. And look, I'm just praying for you guys out there, praying for our nation, and I wish you well. Please be happy, please be safe, please be healthy. Dr. Andrew Kim signing off. Be safe, everybody. Thank you.